Good morning and thank you very much for joining us. I am Yori Folari alongside Asukwo James, TVC News Editor.
Good morning. Good morning, Nigerians.
Indeed. Good to have you back. You've been away, but I know it was, if you were a politician, we'd say urgent matters of state.
Yes.
So I'm sure this one will be urgent matters of journalism.
Yeah, exactly.
And reportage. Anyway, good to have you back. Whatever, a little light humor in these dire times. Still on our mind, the unfortunate story we had to do yesterday, talking about Uwa in Edo State.
Exactly.
And protests by students now following in the wake of that, police moving in. Okay, that to one side. We don't really have an update, and of course TVC News will be keeping us updated on that story. But here we are. We're gradually approaching, shall we say, 100 days of novel coronavirus, COVID-19 in Nigeria. If we start counting going back to February, I think the last week of February, and the Italian index case, right?
Exactly. And since then it has been a very, very serious matter. In that Lagos has been now that
The
it's still
epicenter,
the
yeah.
epicenter.
Yes.
Okay, of the virus, has been grappling with the virus and how to contain the virus, the spread and all. And the federal government actually, came out to announce measures, but those measures were just measures that will be able to contain the situation around Lagos, but it actually spread. Lagos is it's cosmopolitan, and so many people come to Lagos, and in coming to Lagos, they also travel. And don't forget, even when we had that index case, we were still having international flights. And so many people are still coming into Nigeria using the airports, and that was how our hands now are really full.
In fact, as you are pointing out, since February, when the index case was announced, first of all, when we had it and it was announced, between then and now, there's been so much water under the bridge. Since then, a presidential task force has been established, and we get daily briefings from them. NCDC has come more into prominence. It's like every Nigerian now knows about the Nigerian
Center for Disease Control.
Center for Disease Control. We've had all sorts of regulations. We've had curfews, not total curfews, and we've also had attitudes to those curfews, and that's something that we probably will be talking about as we sort of try and trace how it's been these past 100 days. We've had, I think we passed that. We passed the unfortunate mark of what?
10,000.
10,000
Yes.
Cases.
Yes.
Yes. And
and even at that, people are still saying that is not the actual figure.
no,
in
it can't be,
Nigeria,
because we know we have limitations.
Exactly.
When we want to say it discreetly, we say we have challenges and limitations in testing. Because, putting it very, very simply, if we could test 1 million a day, how many are we? 200 million? 200 million?
200 million.
Yeah, so if we could test 500,000 or 1 million a day, pan-Nigeria, we don't know what the figure would be, but it certainly won't be the figures that we have. Then we've had, ebbs and spikes. Sometimes you say that we will hear from one state or the other. For a long time, there was a state that actually prided itself on not having a case. But then commentators
No,
have
there
said,
are even 2 states.
two of them. But commentators were saying that goes back to what we've just finished mentioning, right? The lack of widespread testing. We'll come back and talk about this, and we'll also be joined by, shall we say, stakeholders. We'll be speaking with Dr. Luchi Ubani later on, and Japhet Olugbogi. That's chairman of the committee for
COVID-19, that is the Nigerian Medical Association.
In the Nigerian Medical Association. Okay, maybe to sort of set the ground for us as we approach 100 days of COVID in Nigeria and our response to it and reactions to it, let's take this report that sort of puts it all together.
Necessity, they say, is the mother of all inventions. Here comes the child of necessity, a disinfection walkway for humans, invented at a time when the spike in the number of COVID-19 positive cases forced the federal government to impose a lockdown in some parts of the country. Work is in progress. Collectively, a group of local scientists, researchers and technicians assemble a health equipment that may slow down the spread of the coronavirus.
I've been teaching and working in the wild, especially with wild animals.
Enang is the inventor of this first locally made disinfection booth. He is a forestry and wildlife lecturer and researcher. For him, coordinating the execution of this project is one of a kind.
We did all the engineering designs, day and night. We work here. Of course, the lockdown didn't allow us to move. So we camp here, men and women, working round the clock.
Conceiving the idea was not a problem, but executing this plan was almost an impossible mission. Now, out of desperation, the country is looking up to scientists, tertiary and research institutions to provide solutions that can break the chain of transmission.
Researchers are there, researchers are waiting, but there is no funds. Even when the fund is there, the bureaucracy will kill you.
But back to the workshop for manufacturing the disinfection walkway. We are told this decontaminates and kills all bacteria and viruses it comes in contact with.
Every machine, as you have seen, has a fever detection thermometer which raises an alarm once your fever is above normal range.
His group of company, Jamob Energy, powered this initiative in response to the urgency for a remedy to the ravaging pandemic.
I am driven by innovation. I believe that we have right-thinking Nigerians that are in this country and they have what it takes to fix any challenge.
The federal government is still racking its head on how to safely ease the lockdown and reopen the economy. But Mr. Momo says installing this disinfection walkway at public places is a smart way to keep more people safe. Indeed, a novel precautionary measure against the novel coronavirus. This would have cost a lot of sweat, hard work and money. Maybe with more of this innovation in Nigeria, it would be safe again to reopen the economy. Femi Akonde, TVC News, Abuja.
Femi Akonde for that report there, and really an admirable effort, and that's part of where how we are reacting and responding to this, and it also points to the search for a vaccine. You know, because first of all, it needs to be said as well that since we've begun to grapple with COVID-19, we've also had a number of cures. People have been
claims that they have.
No, I'm talking about officially. Okay. People have been taken care of and they've been discharged.
Yes. In terms of treatment.
In terms of treatment, successful treatments.
Exactly.
Maybe that's the way to put it.
Yes.
Successful treatments. I mean, when you are coronavirus free, we take that as a successful treatment, and NCDC has had cause to announce such. In fact, it's almost a daily occurrence. The problem is that the rate of infections by far exceeds the rates of discharge. And we've also looked at quite a number of options. In recent times, talking about this 100-day period that we're approaching now, in recent times there have been calls for us to now begin to look inward, because experts have said that the vaccine that people are expecting, it's not a quick thing. That's not how it works, especially as far as Western medicine, Western pharmaceutical, pharmacology and all of that. As far as that works, trials upon trials, and of course led by WHO, they are all being classical. And they are saying that, in fact, they said the best estimate is that maybe because there is no shortage of money, there is no shortage of intention, maybe we're looking at between 18 and 24 months. And they say even at that, if that is achieved, it hasn't ever been done before. So it's just that because there are no impediments now, everybody is on board with this, that perhaps the earliest reasonable time to think of getting a vaccine might be around between 18 and 24 months from where we are, but also put the important caveat that should that even be achieved, it needs to be said that it has never been done before.
But they were even suggesting January, the January that is coming, but just like you said, it has to go through clinical trials, and evaluation from across all by the WHO. And thankfully, Nigeria is not sitting idly by. We are trying to find local and homegrown solutions, in terms of now medicine, getting a cure. I know that about three companies were actually shortlisted by the NAFDAC. And then what we just watched now by Femi Akonde, so it shows that Nigerians can also do this, can help, curtail the spread, as well as find solution to COVID-19.
Okay, let's take a break now. When we come back, maybe we should look a bit at our attitude to COVID-19, especially against the backdrop of government having strategically further relaxed conditions, in terms of social distancing and all of that. When we come back, among other things, we'll look at that. And the fact that some people are actually mistakenly thinking that COVID-19 is over. Stay with us, please. We'll be right back. Okay, welcome back, and I'm with Asukwo James, TVC News Assignment Editor. We'll be getting stakeholders on the phone shortly, but we need to say that COVID-19 is not over. COVID-19 is not receding, even though there has been a further relaxation of some of the conditions that we had to impose on ourselves in our own interest. COVID-19 is not over. Is not receding. And I wanted to say that because one is beginning to hear some misinformed people taking the situation we have on our hands now, where we're having to strategically and carefully relax all those restrictions, some of those restrictions, but not all of them, as an indication that COVID-19 is on the back foot. And that would be a mistake.
Yes, exactly. Even if you look at the interstate travel ban, for instance.
Thank you. Thank you.
People still feel that they need to travel.
And are traveling, much to the frustration of the governors.
They are also traveling. If you have Uncle Yori, I even saying the governors, most of the governors are also traveling. So that one is not even an issue. But I'm even talking about the people making trips when they say don't travel. And then even the curfew. The president has said no movement from 8 p.m. to 6 a.m.
Yeah.
But you still see people moving around. When they say curfew, it means they are not supposed to see anybody except your essential service.
Well, that speaks to part of the attitude thing that I was talking about.
Exactly.
What our attitude has been.
And then the police also trying to enforce.
Yes.
When once they say curfew is supposed, if you are not on essential duty, whether you are driving a car, you are walking, you are supposed to be prosecuted. Yeah. But you find out that the only thing that the police will do is just to, stop the cars, people are walking, and there's a curfew. No. So interstate ban, people are still traveling.
These are part of how we have been engaging with COVID-19, which is a problem. And as I said, you see a relaxation. You don't see face masks, a lot of those face masks are worn on the chin. Social distancing, the experts say 2 meters is fine, thank you very much. People don't maintain that. We have to open the markets, and this is beginning to go to where we are at. We have to open the markets.
And even the banks now. Have you
well,
gone to the bank recently?
You know, you just said, you know, you in Inter earlier that the curfew is from 8 to 6, which is indeed the way it is now.
But they've even moved it from 10 to 4 a.m. now.
That's the new regime. That's the relaxation, you know? Because there's been a whole, you know, slew of particulars that have been adjusted. Number one, work will now go back to normal subject to the number of people. I think it's 75 or something like that.
Yeah, 75%.
Subject to it, 75 people on staff being actually on premises, but all the other conditions are not relaxed. So we're going to have to, again, begin a whole series of information campaigns to explain to people that COVID-19 is not over, it's not on a back foot. We have to open up because we have to open up the economy, lest we hurt ourselves more than we can actually heal ourselves. Where here we are trying to, you know, protect ourselves from COVID-19. We're having an uphill battle with that. And now this is coming. We don't have a choice. We have to open up. Schools, by the way, in the new provisions will, I think the way they put it is that states will decide. States will determine.
For schools, it remains shut.
It remains shut.
Yes.
For religious houses, that's the one that states can,
the states will now decide. Then hotels will reopen. But I'm also, this is where my concern is. You're saying hotels should reopen, but bars, gym, nightclubs, parks, you know, should remain closed.
Yeah, those ones.
But you know that there are some hotels that have bars. They have nightclubs.
So
what will happen?
Which
so
part
they will close
of
their bars and
which part of the word bar do hotels not understand?
So,
if bars
it is only the rooms
closed,
that will be open.
Yes.
Then there are the bars.
Because it's an emergency. I would expect that bars would not open unless, well, we'll see how it goes.
Well, what stops the PTF saying that, okay, hotels, your bars can open, but make sure that you have less than 20 people.
And then you have social distancing. What kind of drinking is that? What kind of bar is that? No, what kind of bar is that? What kind of 2 meter? I'm telling you, anybody who likes a table, you know, will tell you that being 8 miles away, I mean, I was just joking, but I mean, I would have, well, we'll see how it works. But if they say bars cannot open yet, even if the bar is within an hotel, I imagine it would still apply. But we don't know. Let's not waste, let's not spend too much time on that. But you can understand why, well, they say hotels will open. Again, it's part of not wrecking business. Hotels will reopen, but the ban on interstate travel is still on. Now, one of the most useful uses of hotels is that somebody's coming in from another state, doesn't have family, doesn't have accommodation here, you can check in an hotel. So maybe in terms of that,
there is interstate travel ban. So why is the person traveling from maybe Ogun State to come to Lagos and then he wants somewhere to stay?
Yeah, exactly. So
if there is a ban, stay in your state. So then there's no point coming to Lagos.
There are other businesses that hotels...
And then the airlines, yes, okay, fine. Now that the airlines will be opening, because they will start, I think, June 21st.
Yes.
You know, 21st of June. So it means that is where they can now say, okay, fine, hotels can start, opening, and then they can start accommodating and putting people.
We were talking about bars. We're talking about bars, and we just had that little back and forth on bars. Hotels are known for their dining, So, and
will it be takeaway?
Well, that was what I was gonna say. All restaurants, are still under that stricture.
Yes.
It shall only be takeaway. The fact that your restaurant is in your hotel, which part of restaurant do you not understand? Just like which part of bar do you not understand?
But you can still open the bar and let it be takeaway.
Yeah, room service. Yeah. I don't know. We'll see how this is going to work, or if they're going to say, well, an hotel is a complex, and so the restaurants, what we're saying about restaurants don't apply to hotels. What we're saying about bars outside don't apply to hotels. These are things that we're going to have to work out. But the other most important thing is that there still is a ban on gathering.
Exactly.
The biggest crowd you can have, if you must have people together, is 20. And even at that, there should be social distancing. So talking about churches and mosques, for instance.
I know Lagos have this initiative called Register to Open. And I think it should be applicable to also religious bodies to go in there to register and say, fine, maybe I'll be having 6 services, 20 people per service.
Thank you very much for talking about that, because that reminds me of something else I saw in that list of conditions. Normal services. Now, what is a normal service? If you're a Muslim, does that mean Jumat service, which is on Friday? That's a normal service. If you're a Christian, does that mean Sunday worship? Everybody goes to church on Sunday, it's the Sabbath day. All those ones within the week, don't go there.
I think that is where they also need to break it down. Because I know, like Tuesday, some people go to church on Tuesday, maybe for Bible study or some prayer meeting on Thursday.
Is that a normal service?
So except it's just going to be only Sunday. So they need to clarify this for people, because so that people don't start trooping to church on Tuesday or Thursday or Saturday, or so it has to be specific.
That's why I started
only
out
Sundays.
That's why I started,
only Fridays.
That's why I started out with COVID-19 is not over. It is not receding, even though people might really desperately want to think of it like that. And this is where all these questions shall come into play. They need to be clarified, because I don't imagine that the authorities are going to be very happy at anything that, defeats the general wisdom of maintaining social distancing. So if, because of all the other conditions that they said, look, we can relax those a bit, if people don't take it in the way of, look, these are very, very delicate times and very, very dangerous times. So we are appreciative of this relaxation, but we're going to be very, very responsible about how we go about it. Now, how they're going to work out, there are different kinds of churches, different sizes. But I think the one thing that people are going to have to address would be social distancing within the church. Not all pastors are happy with that, but still, we'll see how all of this is going to work out.
But any pastor that is not happy is then...
Not just pastors, even imams.
The thing is, they need to... This is a global problem. It's a global crisis.
That's why perhaps we need to be emphasizing that this relaxation does not mean the COVID-19 situation is any better than from that first week in February. I mean, that last week in February.
The thing is, the pastors should also know that they said, watch and pray. So while we are watching and seeing how we can also work, with the people to see that this thing is out, we'll be praying along.
Yes.
So it behoves on them to see how they can have the numbers that has been directed by the WHO, not more than 20, at a particular service or at a particular sitting.
Again, we'll see how all of that
so they need to really break it down.
I think people just need to be saying, to understand that we're still in the midst of this war, this health war. It still is a war situation,
and they shouldn't even start to say they want to rush to open their churches if they don't have those things like the sanitizer, the wash hand for people to wash their hands.
Well, we are saying this. They are listening, but no doubt there are those who can enforce, the best practices, because we can't stay cooped up at home forever.
Exactly.
We know, but there are responsibilities. Let's take a quick break, and please stay with us. We'll be right back. Okay, welcome back, and we have Dr. Oluchi Ubani on the line. Well, there are Skype is also sort of a line. Good morning, Dr. Ubani.
Good morning.
Now,
Good morning.
Yeah, thank you very much for joining us and making time to join us. As we're looking at how far we've come since that last week in February when we had our index case, and now we're at the cusp of relaxing further the restrictions that we have had to impose on ourselves. Are you concerned, Dr. Ubani, that people might take it erroneously as an indication that COVID-19 is receding, or indeed that it is over?
Okay, so I'm concerned with the relaxation, but by the way, Nigeria, we've gone far. We've tried our best. At least there is more contact tracing and there are more testing going on. People are being tested, and I believe that as time is going on, the testing will be more proficient amongst all the 36 states, including the federal capital. Then relaxing the lockdown, the procedures being taken, I think is okay, but we should still, as I also want to advise professionals, they shouldn't relax their guard. Everybody should be prepared. It's just that they're trying to make living easy for us. They're not saying, oh, throw away the mask or throw away your hand washing or let's start getting glued together. They're still saying keep that distances. Those needed procedures and precautions to be taken is good to take them. Then I think more contact tracing should be done, more testing should be done. I saw in news in Ogun State about the walk-in, drive-in, you go and test. I think that should be more advocated so people can test more. And if they are tested and they take treatments on time, you will discover the stigma that comes with it. People are scared. You hear of someone escaping from quarantine areas because of the scare and afraid of being stigmatized. It's not a death sentence. The people are getting cured. So I'm advising Nigerians that yes, they're relaxing the lockdown, but we should still keep our precautions and so that the spread won't be much.
So in terms of, because I'm also concerned about the front health workers, what can you say about that? Are you getting enough equipment, for you to take care of these patients, or do you think the federal government is doing enough?
There's starting from when it started, when we were still trying to understand the dynamics to now, I think there's an improvement. Most facilities have gotten some of the requirements, but we need more. Like you have the more supplies of nose masks so that it can be available. It's more available now than initially, where we were struggling to get them and have them at a particular quantity. Then more people are being educated, healthcare workers are being trained on how to use these PPEs and how to manage patients. People are getting more aware. Yeah, people are getting more aware and taking precautions. Unlike before, that not it was like as if it was only those in the government sector, like working in government hospitals, that were taking these precautions. But now private parastatals, like private hospitals, clinics are being able to acquire these equipments. Then I think more can always be done. You can always receive more equipment, more ventilators, and more PPEs that will go around, so that even the cleaner in the hospital should have them on. Cleaner in the hospital, gate man out there, and the rest of it should be more. Then more testing centers. I think we've done so good so far, because I've been in contact with some other colleagues that are outside Nigeria, and comparing what we are doing in Nigeria and other states, I think we are doing our best, but more can still be done. We'll get there, more information is spreading, and more PPEs will be distributed, not workers and all, not just the MBBS, all professionals in the healthcare field, because people that have dental issues, those that have eye problems, those that need to see the physiotherapist, and all different, even the nutritionists, as well as the nutritionists, everyone needs to be carried along and to work together. When we work as a team, I think we will achieve more.
Okay, let me ask you this. I think it's going to be a professional question. COVID-19 has these flu-like symptoms, and then the rains are here. Should Nigerians get worried? Because I know when once it rains, everywhere is cold. There will be so many people that will be having catarrh and all that. So should we get worried? Because I know that is what over there that is what they've been going through, cold weather, and then the numbers spike. Should we get worried now that the rains are here?
So I think if you can worry for a good reason, for people to take precautions, even before the COVID symptoms were x-rayed and differentiated from other symptoms. During the dry weather in February, January, December, we had this dry cough. Nigeria, due to the climate and the weather condition, there are certain symptoms that are being on ground. Same thing with this cold weather. So I think when the World Health Organization was differentiating and other organization, NCDC, they said the difficulty in breathing. Now, when you have people that are asthmatic, they can experience such challenges as well. So I think everybody should take precautions. Nothing changes. Just take your right precautions. No one should fear, because when we panic, we do things that are wrong. So just calm down. Know, okay, normally if during this weather, most people, they have different resistance level. If you know that, oh, during this raining season, I usually experience these symptoms, you take precautions on time.
Okay, one moment, Dr. Oluchi. Sorry to interrupt you. One moment, please. Mazio Okoroafo has called in on the phone. Good morning, sir.
Good morning, sir. Good morning, Dr.
Good morning.
I want to find out from our sister on the sky. Now, students are hurrying to go back to school because they have overstayed at home, especially those of them who are writing WAEC, NICO and NAPTEC, May, June. Now, they want to go back to school. What is your own, as a professional, what do you think the parents should tell the children for now, so that they will get themselves prepared before this, maybe the government will open maybe by July or August. And that will notwithstanding, you know that anyway, that as of, we are talking today, Nigerians don't believe that there is COVID-19, at least 50% or 60%. That is what is going on. And the issue of this face mask they are talking about, is it not advisable to tell the religious leaders and government that there must be face mask before you start any Muslim the church or worship center or Christian worship center?
Okay.
Thank you very much. Have a blessed day.
Thank you very much, Mazi Okoroafo. Dr. Oluchi, did you want to comment?
Yes, I can explain. So thank you, Mazi Okoroafo. So for the students at home, I actually even thought about those ones that are supposed to resume school for the first time in September, that experience, and then they can't make it. I also thought about those that write their WAEC, and I even have younger ones at home. So if there are schools, it's no news, there are schools that can't participate, that can't afford the online training method that's been going on in most schools. So I was thinking about, there are certain solutions I thought about. If the schools, the particular schools, if they are government schools, if they can record maybe a particular subject, a teacher can come into the class, they record a particular subject, they have the curriculum which they are supposed to go through, they record a particular subject, and then they record it as a CD and distribute. This is something the government can do.
Okay.
This is what the government can do. Dispatch this, then the nose masks, yes, it's essential, but it's not a total. Wearing the nose mask does not mean you're not protected from COVID-19.
Oh.
So when you put on the nose mask, you should, because people are having difficulty in breathing when they put on this nose mask. So it's advised when you put them on, you shouldn't take big steps. You should control your breathing, maintain a good breathing. Don't run with it. Don't walk too fast with it. Then also, when you are supposed to take one and remove them, so we should try our best as Nigerians. We are doing, COVID-19 is real. It's happening. That's what I want to tell everyone. Those that thinking is a joke. Don't wait till it happens to you for you to realize that yes, it's real, it's happening. This thing is happening and it's real.
Thank you very much, Dr. Oluchi Ubani. And it was a fine place to leave it. COVID-19 is real. We really appreciate your time. And we also have joining us on Skype Dr. Japhet Olugbogi. He's the chair of the Committee for COVID-19 in the Nigerian Medical Association. And Reverend Dominic has also come on the line. Good morning, Reverend.
Good morning, Yori. Sorry, I can't see you because my device just got off, but I can hear you.
Okay.
Can I continue?
Yes, please.
Yeah, Yori, please, I want to thank the government for relaxation a little bit. I want to appreciate what they have done. You know, I'm a pastor, and I want to speak for pastors.
Yes.
What pastors must do is caution. And I don't think we're supposed to tell pastors what to do. we are the one who tell people what to do. We must know how to organize our churches. And also, I want you, Jory, and your colleagues in the media to give us pastors some benefit of doubt. Some of you are talking to us as if we are dwarfed, we didn't go to school. Most of us are purely professionals, as you know. We know how to organize ourselves.
Okay.
After all, the life of every believer is important to the pastor as a sheep and a shepherd.
Indeed.
But,
Reverend, it's a good point you bring up. I wanted to find out from you what aspects you take exception to out of the guidelines that are being communicated.
All the guidelines is in order, but I think about math. For you to come to church with math, Yori, it will be funny. And when you're praising God, I don't know how it will sound. I don't know how it looks like. But we're going to prove it out. That somebody comes to church, it's going to moo. You know, that's what they say. Or that's what I mean.
I hear you.
But we must have a way to manage it.
Okay.
Understand?
Okay.
We pastors are helping the public to make it right. And you in media should give us a benefit of doubt. We're not, this dumb.
Okay.
We know what to do.
No, I'm sure. Thank you very much, Reverend. I'm sure nobody ever had that kind of a notion, but you don't need me to tell you that some people might be thinking that, well, God actually listens to our heart. And so, whatever the constraints of the physical voice, these are different times. But let me just leave it there because, as you said, pastors, don't like being told what to do. And I don't think anybody is really doing that. But we'll return to the matter. Thank you very much, Reverend Dominic, for calling in on that particular point. Dr. Japhet Olubogi has joined us. Good morning, sir. Chair of the COVID-19 committee within the NMA. Good morning, Dr. Olubogi. Okay, let me take Mr. George in Ikeja. Good morning.
Good morning, Uncle Yori.
Thank you very much for calling.
Uncle Yori, I think the government should try to make laws that are workable. How do you say somebody should open his hotel, his bar, the bar in the same hotel should not be opened?
No, they didn't say that. Me, I was just trying to understand it. If you say bars cannot open yet, but hotels can open. So I was then saying that, will the bar within an hotel be treated differently?
But yes, it's a good question. How practicable is that? And even if when the bars are open, how are you going to say it is only a particular number of people that can be there? How are you going to enforce that? We saw videos of when the lockdown was even in session. There was no relaxation was done. And we saw them in Abuja, where they were drinking and eating pepper soup at one bar without social distancing. Not to talk about now that we are saying a relaxation has been made.
Yes.
People will not just, it's not practicable. What I want to beg the government, please, they should not reopen our schools yet, so that we don't start killing our children because we're in a hurry to make money. That's just my advice this morning.
Okay. Thank you very much for calling in. Yeah, when we had that conversation, Asuko, about what seemed to be, the paradox of bars cannot open, restaurants cannot take in sitting customers. It can only be takeaway. But then you open hotels. So how are we going to apply that, for instance, the bars? I can imagine that the hotels, I can imagine that they might say that in the restaurants, you will not have more than 20 diners at one time, and they must be, 2 meters apart. I don't know how that's going to work, but these are things, or unless government is going to say no,
maybe no
it
bar,
doesn't apply to bars. I just don't know. That's why Mr. George started off by saying that people should just make regulations. Government should just make regulations that can indeed be adhered to, that are sort of workable. But we have to open up, and no doubt we'll be casting our glance at what's happening in other areas of the world and how they are handling it. because the emphasis is safety. Mr. Gbonna in Festa, good morning, sir.
Yeah, good morning, Uncle Yori.
Thank you very much for calling in. Good morning.
Yes, I want to contribute about the ease on lockdown.
Yes.
Yeah, you said the market should open. Worship places should open, right? And interstate movement is still on lockdown. Now, I want to make a point. It is easier to control the spread of COVID when interstate movement is allowed, because the transport companies can be given conditions. For instance, don't carry more than 10, don't carry more than 8, provide testing kits at every bus stop and stop. It's better, it's easier than the market. The open market, is it the woman that is selling paper that you will tell to test somebody before he buys paper? So I want the government to look at this problem.
Okay.
Thank you.
Thank you very much, Mr. Bodna, for calling in. It's a complex thing, but as I was saying, as we were having this conversation on, we don't seem to have a choice. We have to open up our society, of course, with controls, with regulation, but we have to open up society again. How seriously we now take this, that's why I was emphasizing that I hope this is not going to be seen as COVID is on the decline, is on the back foot, or it is over. But let's try Dr. Japhet Olugbogi again. Good morning, Dr. Olugbogi.
Good morning, Uncle Yori.
Good morning, sir. Okay, thank you very much.
Having me.
Okay, indeed, our pleasure. Dr. Olugbogi, we're looking at how far we've come as we begin to approach, I think on Saturday, 100 days officially of COVID-19 in Nigeria and our response to it. Now, the latest where we stand now is that government has given us indications that because of the need to open up our society, we will do so with certain strictures. Curfews have been relaxed, for instance, from 10 now till 4 a.m., not what it was before. Regulations on bars. Now, all of that, be that as it may, but because you're a doctor, the first thing I wanted to ask you is that how concerned are you about the number of beds that we have to treat the COVID-19 cases that we need to treat?
Yes, thank you very much, Uncle Yori. Thanks for having me once again. Well, we don't have enough beds to treat COVID-19 cases. And I don't ever think we can have enough. We don't have enough in other parts of the world as well, but we should make do with what we have. I think what we can do is everybody take responsibility. But it's clear now that no matter what we do, no matter what the government does, the virus will be in the society. And if people don't take responsibility, no matter what measures we take, we can't have a head game. So we all need to take responsibility. While the society is going to be opened, albeit gradually, what needs to be done is for everybody to abstain from gatherings, social gatherings, gathering of large numbers, wear their face masks, wash their hands, use hand sanitizer, maintain social distancing. If we can do the type of the virus. We know the right thing to be done, first of all, is to ensure that people who have the virus are away from those who have the virus. But we have seen that that is practically almost impossible. Now, if we can't do that, then we should begin to take other measures into cognizance. We should begin to practicalize what is operational in our country, what is practicable in our country. And what is practicable in our country is that we maintain social distancing, we all wear face masks, so that we don't share the virus. We ensure that we maintain away from one another, and we wash our hands. For instance, we have a gang of about 20 people, and they're all wearing their face masks. Even if one or two people have the virus there, they won't be likely that they will spread the virus.
Yes.
Whether very difficult, and maintain social distancing.
Okay, Dr. Lubogi, one more question. I think because of the shortage of beds and the pressure that is being brought to bear on our healthcare system, there have had to be adjustments. I want you to comment on how is this okay? Is it dangerous? And I'm talking in particular about the time early on when you needed to have 2 negative tests before being certified free of the virus and consequently discharged. Now I hear that
There's only one.
there's only you need only 1 negative test now to be free. How safe is that?
Yes, thank you very much. Like you all say, when a problem arises, we need to think outside the box and think for practicable solutions to be able to build the solution. At the beginning, like you rightly said, we should carry out 2 tests and ensure that individuals who are at the isolation center have 2 negative tests. But when we found out that a lot more people are recovering and then we needed more spaces, agreed that we should do just 1 test. And when that 1 test is negative, the individual can be discharged. But I found out that individuals take between 8 to 10 to 12 days for them to test negative at the isolation center. So when an individual who does not have a serious illness, maybe just have mild symptoms, goes into the isolation center, by day 10, you expect that the individuals that have reduction in their viral dose. So when you check them at that point in time and they test negative, it can discharge them so that the bed can be freed up for other people who are contaminated.
We get you, Dr. Lugbogi. The line is breaking up a bit, but we did get what you said and the way you explained it. And I want to use the opportunity to thank you very much, sir, for making time in your busy schedule to talk to us and educate us on advances in our procedure and generally grappling with COVID-19. Thank you very much, Dr. Olugbogi. And we also thank Dr. Oluchi Ubani, who came on earlier. And as indeed, we thank our people who have called in on this whole matter. As we approach 100 days of COVID-19 in Nigeria, this is like the first. I imagine that we'll also have other programs that will be sort of looking at it because it's a big subject. And we can't overemphasize the point that COVID-19 is not on the back foot. It is not receding. It is not over. The doctors, all the specialists, all the experts are saying that we still have to keep our guard up. I suppose we'll have to leave it there for now.
Yeah.
So thank you very much for joining us. Please join us tomorrow for a fresh edition. On behalf of Asukwo James, I am Yori Folarin saying bye-bye for now.